Hey everyone, welcome back. We're going to be talking about certainly a topic that my patients are really concerned about, which is their weight around menopause and peri. Great to have you guys all here. My name's Ginny Mansberg. If I sound like I have come from far away, that is because I'm from Australia. I have travelled furthest. Do I have the biggest commitment to this show? I think so. This is my book, The M Word, How to Thrive in Menopause. I did an audit recently of my patients, so I always ask, what are your symptoms and what are your main concerns? I only see peri and menopause. And actually, weight gain was the biggest concern from my patients, which I thought was really interesting, more concerning to them than hot flushes and loss of sleep. So we have collected 3 amazing experts. So you already know Nigel because he's just been up on the stage, so he's the menopause dietitian. We have brought a collection of Charlottes for you today, which is excellent. So we have Charlotte Hunter, who is a nutritional therapist, and poor Charlotte Norton, who is not enormously fat and spinning a whole lot of bullshit for you. She actually has a baby in there. That's why she looks like a whale, but she's not actually.
I feel like a whale.
Feels like a whale, looks like a whale. That's all good.
Yeah.
I thought what we'll do with this topic is we're going to whiz through some things pretty quickly because we really want to get to your questions. You've got 3 experts here. Don't miss your opportunity to actually ask them some questions. So, Nigel, I thought I'd start with you. What happens during peri and menopause? What do you see in your clinic and why? Why is this happening?
Well, Ginny, I would describe it as this perfect storm. And I think what we're seeing is a combination of falling estrogen levels, changing where the body lays down its fat, which is why so much of the time we see the weight gain typically forming around that middle area. Women coming in saying, I don't know what's going on, my bra doesn't fit, my trousers don't fit, my jacket, nothing's fitting, but it's all gone on around here. I never used to gain weight here. That's estrogen. Estrogen isn't making you gain the weight, it's changing where it goes. We know there is a shift in metabolic rate as you start losing some muscle tissue. That's just getting old. That happens to me as well. It's not necessarily just a female thing. Although we wonder, does it speed up a little bit as you start losing your estrogen? But my goodness, you're under a lot of stress. Your body's maybe holding on to a bit of fat as well in case it needs it because you're in this state of permanent stress. We also see, though, that maybe some of the habits that you were getting away with when you were 30, you're not getting away with those anymore. That extra glass of wine at night, maybe the grazing instead of proper eating. And also, if you're feeling rotten, I don't know about you, but if I feel rotten, I eat. And I eat all sorts of things that I know will make me feel better. And that's usually sugary things, fatty things. So there's a combination. And of course, what we've always done previously, isn't it? We've looked for a quick answer. And we've looked for an answer that's outside of ourselves. Or it's because I'm stressed. And actually, this is a time, if you understand what's going on, I think this is a time where you can break free of that kind of diet mentality and think, this is actually the moment to clean up my lifestyle. I can really do it once and for all and break free of all of that.
So Charlotte Norton, what's your approach when you see women who come to see you about gaining weight or any other concerns that they have? I think I asked Nigel once, does anybody ever come in and say, I'm really worried about my cardiovascular risk factors at this point? Never in the history of ever has anyone ever turned up to a healthcare professional and said, help me manage my LDL profile. Yeah. But they generally come asking you about their weight slides. So I'm going to skip to that. What's your approach?
Yeah, so just to be clear, so I'm the medical director for the Slimming Clinic, which is, so we see people that are looking to lose weight at all stages of their life, but a massive portion of what we see is menopausal women. that have, for all the reasons you've touched on, Nigel, have got to that point. So the way that we work, and I think what you said is completely right, it's diet is a portion of helping us to lose weight, but it's that whole lifestyle behavioural change that you need to look at. One big thing menopausal women struggle with is sleep, and just literally lack of sleep can help you contribute to your weight gain. So the way that we work with the patients that come to us is we look at you, we look at your lifestyle, we understand where you are in your menopause journey, where that's going, and then, we focus on what we call the 4 pillars. So diet, adjusting what you're eating to try and make healthier habits, movement, what we're doing in terms of moving. We know that we know with age, and menopause generally comes with increasing age, we lose our lean muscle mass, which then makes our basal metabolic rate, the calories we burn when we're doing nothing, go down. So we look to try and help put that up. We look at mindset. There's often things you can do to try and relax, try and help your body, heal itself. Diet, movement, and medication. I should know that part the best, being a doctor. We offer patients the ability to use appetite suppressing or appetite controlling medication that gives them that kickstart, the ability to change what you're eating whilst you make those behavioural changes that then can help you achieve that weight loss aim.
So Charlotte, you have a slightly different approach. Tell us about your approach to women who are at this stage.
I think I can echo what Nigel and Charlotte have both said, really, about the stress and the lifestyle, because I think you just said it perfectly, Nigel, about the stress side of things. It's not just the big life events that we talk about. So it's not just bereavements or divorce or house moves or like that. It's the day-to-day stuff. And I think when you're going through menopause, there's just more going on in your brain as well. I think a lot of women talk about their brain fog and, I can't remember anything because it's menopause. But I think sometimes that is just because we've been around a bit longer, therefore we've got a lot more filing cabinets in our brains and a lot more keys, and it's trying to find the right key for the right filing cabinet at the right time. And I think all of that adds to the stress. But in terms of the ladies that I work with, they are primarily weight loss clients, and I've got a program that I work with. But the big thing that I find is just telling them to stop snacking. And you talked about grazing, Nigel, and I think that's the big thing that makes the difference, I think, for weight loss in particular, because let's face it, we've got one stomach. We're not cows, we haven't got 4, so we don't need to be eating the whole time. And if you tune into that pattern of 3 meals a day, you're allowing your body to do what it's supposed to do, and to access its nutrients how it's supposed to, and burn fat how it's meant to. So it's much more structured and it's non-negotiable.
As a clinician, I feel like when I see a woman with menopause, she's very rarely totally fine. 75% have hot flushes or night sweats. Nearly half will experience insomnia, and 1 in 3 will get anxiety and depression. And it feels so cruel at this point in time where so much is going badly to now say, and now you've got to go on a diet, stop snacking, stop drinking, start exercising. And yet it is critical. I find it very difficult as a clinician to support my patients through this, because at the end of the day, there is only so much we can do with all the medical tools in the planet, the hormone replacement therapy, everything else. It doesn't work well in women who are obese. We know that. And I hate to be the person who's cruel, but we have to. Now is the time. If we're going to get your blood pressure under control, if we're going to get your bone health right and prevent fractures in the future, if you're going to prevent that future dementia and going into a care home, your time is now. The evidence is what you do in midlife is what sets you up for good health in future life. Nigel, I did want to touch on medications. You and I have spoken a lot about it over the last few months. How do you find medications work with your patients?
It troubles me in some ways that this is positioned as, a magic wand. Ultimately, if you're going to be prescribed any kind of medication to manage your weight, you are still going to need to take all of the lifestyle changes that we've been talking about. You're still going to need to adjust your diet. You're still going to need to embrace and find a way to move your body that you enjoy. And you're going to need to do that forever. And I sometimes worry, well, is the medication almost being used as, if you like, the incentive to do what, if you did that anyway, you would make some serious headway. And I worry also that a lot of the patients that I've seen who have tried medication are kind of stuck on it, because if they don't get off it, if they come off it, everything goes back on again. So I think we've got to be really careful. At the moment, a lot of these medications are being handed out without supporting advice, and that troubles me. If it's accompanied by advice that is going to change your lifestyle, then there's a position for it. But just handed out in a doctor's surgery with no support, no guidance as to how to adjust your lifestyle is really, I think, it's like putting an elastoplaster over a gap in a dam, and it's not going to fix the situation.
Which is why I think Charlotte's clinic, where you came to medications last and moved everything else first, is so important. I just wanted to ask you about that, Charlotte, because you must see it all the time. People who are prescribed this stuff with no holistic view around it.
Yeah, it's very frustrating. It's easy to go online these days and order some weight loss medication, have it delivered to home without even speaking to a professional. And yeah, absolutely. We get people that have done that. They've gone on, they've ordered the weight loss medication, they come to us and go, oh, it worked at first, it reduced how much of what I was eating and I lost some weight, but actually now I am stuck. And it's completely right. You need that support package. And if you don't make the lifestyle changes, the medication is a crutch. It can help you. We've all started a diet, and literally the first day you start a diet, all you think about is what you're going to eat that day. Food becomes the first thing on the agenda. So medication absolutely is a great crutch to help with that. But if you don't change what you're eating, you don't change how you're moving, make those inevitable changes, you're right. You will find you get to the end of a medication course and actually, well, nothing's changed. And we know the cycle of weight gain can sometimes be you can end up regaining more weight than you even started with. So, it's a tool to use, but it can be a very successful tool. And with the right support, from a multidisciplinary team, you can achieve really good results. So,
I guess what we've got to remember as well, Jenny, is that right at this moment in your life, the biggest threat to you is coronary heart disease, cardiovascular disease. And this is the one time you cannot afford to regain, because it is all going to go back here. And if it goes back here, that's a passport to cardiovascular disease. And again, not to be all doom and gloom about it, but more women are going to die of cardiovascular disease than anything else. We don't talk enough about it, and it's the one bit that diet, lifestyle and fat accumulation is so relevant for.
It is, unfortunately. So, guys, I want you to get your questions ready because they're coming to you. While you're thinking about your questions, I've got some rapid fire questions that I want to throw at our expert panel here. I'm going to open my arm. Okay. Intermittent fasting, yes or no?
No.
I'm so happy to hear that.
On the balance of things, I would say overall, I'll go for no as well on the balance.
I know.
No dispute.
Okay.
No, never. Don't touch it.
I'm going to give you my perspective because I'm a menopause clinician. I call it brain fog. 80% of women in perimenopause get brain fog. You don't fucking need no carbs in your head on top of everything else. Absolute disaster. And also hangry for someone with a mood disorder is an absolute car crash. And the evidence is not there for intermittent fasting. You're missing a meal. And so hold on to your question because we're going to do some... Okay, supplements. Do you ever need them? Charlotte?
Yes.
Which ones?
New Mind Wellness, downstairs at the entrance.
Okay, all right, so a whole raft of supplements. Charlotte, do you use them?
Yeah, we do. We use a lot of testing to look at people's profiles, and then we talk about specific supplementation.
Okay, and Nigel?
Yes, every woman here take a vitamin D supplement. And on top of that, you might want a supplement if there's a clinical need or if you cannot meet your requirements through diet. But supplements will never make a bad diet good, and they will never replace a good diet.
Love that. Do you change the diet recommendations if your patients have got anxiety or are insomniac? What would you recommend for those very menopausal symptoms?
I don't know. Yeah, I mean, I think it's all about personalised approach, isn't it? So it depends on the woman. So I think it's really difficult to say what would you do in general. But I still think 3 meals a day, no snacking, that is going to help you sleep better. It's going to improve your mood. It's going to balance your blood sugar.
Charlotte?
Yep, individualised approach based on women, lifestyle and medical conditions for sure.
For me, I tend to think if you're crippled with insomnia and anxiety, let's take you to Ginny and get that bit sorted out with a doctor first, because I can't make you sleep. I can't get rid of your anxiety, and you ain't going to do what I'm going to ask you to do if you're running on 2 hours sleep and feeling a wreck. So we work together and fix those things first. Lifestyle takes quite a bit of effort. Mm-hmm. It is the tougher route to go down, but my goodness, if you can embrace it when you're ready and when your symptoms are controlled, it can break you free of that utter misery of that diet treadmill and all the fads and the nonsense. So,
I think you always need to see a dietitian or nutritionist, and you always need to see a doctor, both. There's a role for everybody. I think that's really important. We're going to go to your questions because you're not going to have a lineup of experts like this too often. So why don't we start with yours?
So my question is, because, all of you said, categorically no for intermittent fasting. And I would like to know why. Because, when we effectively having, 12 to 14 hour, in between, dinner and first meal, we are not producing, glucose, and we're not releasing insulin. So that means to me that, we are regulating our blood sugar levels and tapping into fat reserves. So unless you are stressed, I guess, there are some contraindications when you under stress. But why you definitely said that it's not good for menopause?
Go first, yeah.
My view is absolutely that we've looked at the evidence. There is no evidence supporting this for women. All the evidence that's been gathered is on small groups of men. We don't have any evidence that supports it in menopause. In terms of if your blood sugar levels, if you're not consuming blood sugar levels and your insulin your insulin isn't being released, if you're in starvation mode, you're going to use protein before you use fat to provide energy. And protein is your body's muscle tissue. Now, the biggest problem with weight gain is you're losing muscle tissue already. So why on earth would you follow something that promotes the loss of muscle tissue and further slows your metabolic rate? I totally accept. Some people love it. But the question was, could I recommend it? No.
Okay.
Well, I think you've echoed it there in the sense of, yes, when we look at medical evidence, if we give you that answer, we wouldn't recommend it for lots of those reasons. But again, it's about the individualised woman. If it's an approach you want to take and it works for you and it doesn't worsen your other symptoms, then we'd never shut you down as no, you can't do it. And for some subgroups, it does yield very good results. And we have patients that like to use that as a tool. But yeah, from the sort of science side, what your body's going through during the menopause, it wouldn't be the first sort of recommended diet pattern that you would go for.
Yeah, and I think I agree as well. And if you think about it, with some women, if they're stopping eating quite early in the evening, they're going through until some are going through till 12, 1 o'clock the next day. Can you realistically get enough nutrients into your diet at a time when you really need them in that small window?
Yeah, I'm more thinking about 12 hours in between dinner and breakfast.
I mean, 12.
Yeah,
in my day, that was called going to bed. Why are we calling this?
Why do you be surprised
time
how many
restricted
women
eating?
snack
Why
at
don't we
night?
just say, you don't need a piece of cake when the 10 o'clock news comes on. We can't confuse it all with these terminologies.
Yeah.
Just don't have a bedtime snack.
But that's back to 3 meals a day.
Yeah.
Have your breakfast at 7, your lunch at 12 or 1, and you dinner 5 to 6,
And
you
it's
know, and then
kind
you're...
And making good choices. If you know, we often talk about good choices. If you do want a snack in the evening, then think about what you're having. Have a high protein snack, something your body repairs overnight. Hopefully you think about what you're having and what you're eating at the right times.
That protein part is really important because it's important for your bone health and also for your muscle health. And we know now, if you have an osteoporosis fracture of your hip, statistically, within 12 months, 50% of you will either be in a nursing home, a care home, or dead. Too few of us actually care for our bone health. Now, bone health is driven by muscle health, and sarcopenia, which is the loss of muscle tissue, doesn't only slow your metabolism, something that is of great concern to midlife women, but also greatly contributes to your bone loss at later life, which can terminate your life early. Just a reminder that most women who are trying to lose weight need between 1 and 1.5 grams of protein per kilogram of body weight per day. An egg has 6 grams. Very few women get enough protein in our diets. And if you think about like a takeaway Thai meal, the women will pick the noodles and the vegetables out of the Thai meal and the rice, and the men will go for the meat. We are all struggling to get enough protein into our diet, and we do not want active catabolism of the existing muscles that you have that is going to throw your health under a bus. And just to reiterate what Charlotte was saying, we were all on a big webinar held by the International Menopause Society that was held earlier this year, where they deconstructed intermittent fasting and where they showed that nutritional deficiencies amongst people who adhere to time-restricted eating, not 12 hours a day, but who do the 16-8, that is very, very, very common because you're not having enough meals to get the nutrition that you need to supply your body. So this is going beyond you looking great in a bikini, which I'm all in favour of. Go for it if that's what you want. I don't give a shit. I think you all look great. For me, it's about you not getting dementia, not getting heart disease, not having an osteoporosis fracture and falling off your perch ahead of time. And we've got to be thinking about that right now. It's really, really important just to go back to that. Did we have any other questions that we wanted? At the back.
Just to add to your point as well, Ginny, it's also, I think, about women not feeling like food is their enemy.
Yeah.
You know, this is your chance to actually find a way to live and to eat that is joyful and happy.
Just a simple one about the, eating late at night. We often get home late, have an evening meal at 8 at night, and then you're digesting your food while you're sleeping. Is that quite bad for you? Or
do you know, I would be tempted to say I often have to do the same as well. Egg and chips cannot make you any fatter at 3 o'clock in the morning than it could at 3 o'clock in the afternoon. I would be more inclined to say have a meal, a lightish meal, try and have your heavier meal at lunchtime, but don't not eat because you will have your head in a family pack of crisps at 10 o'clock if you don't have something at 8. Absolutely. So eat.
Yeah, and my recommendation would be to, as we've said, to make that don't have a huge load of processed carbs, a load of sugar before you go to bed. That's useless to you. Just so structure that meal light, make it more protein heavy, and slightly less processed carbs, and then that, overnight your body heals and repairs, so it does use, proteins and things like that. So that would be what I would structure someone who's going to eat late, because you have to live your life. If you try and adopt an eating pattern that doesn't suit your life, you're never going to stick to that either. So it's got to be practical.
Our final question.
Hi, Dr. Hugo Kitchen, Stratford Dermatherapy. Run a very, very busy menopause clinic, nutrition, lifestyle and wellness clinic. The one word on your screen, metabolic, nobody's mentioned thyroid testing. We're scientists. Every single patient we see, we take bloods or saliva from, we measure the levels. Our idea is to optimize people's hormone levels. Mm-hmm. We all agree that. If you don't test, you won't know the baseline from which you're coming from. When I test all my ladies for their hormones, 60% are subclinical underactive thyroid. And it's extraordinary when you supplement them with T3, how the weight drops off and they feel so much better.
Yeah.
It's
Well,
not
thanks.
just about weight loss. It's multifactorial. This is all important. I disagree with you entirely on intermittent fasting. The word breakfast means breaking the fast. You can get all the calories and nutrition you like within 8 hours a day or 6 hours a day. It doesn't matter. Unfortunately, the food that we grow these days in the world comes from soils which have been metabolically depleted of anything useful anymore. Our food is anemic. We do need to take supplements, vitamin D, vitamin C, etc., etc.
Guys, we're going to wrap it up there because we've got another incoming speaker. Thank you so much for giving us your time. All of these experts can be found. Can you just quickly tell us your stand so that everybody can find you?
So I'm at New Mind Wellness, which is just out the entrance.
Super. I'm at the Slimming Clinic, which is D27, just over there.
And C40, where the purple balloons are, right over there.
These are incredible experts. Go and see them. We're so lucky to have them here. Thank you so much.
all.